I'll give y'all a break in a little bit. Yes, potassium. All right. Potassium is very acidic. Okay. So what's it going to burn when you take it? The stomach. Okay. So it's supplied a lot of different ways. Orally, we'll talk about IV potassium in a minute, but orally it can come as a tablet, but y'all know they're giant. Have you ever seen these given or given? They're huge and the patients hate taking them because they're really hard to swallow and they hurt their tummy. Okay. It does come as SR tablets. What's SR? Sustained release, because you want to give a patient a whole bunch of potassium at one time. You could kill their what? Yeah, because your keyword for potassium is heart. Okay. It also comes as a powder for people that cannot swallow that big giant pill. Okay. Or it does come as a liquid. Now it's real bitter and it tastes nasty because it's very acidic. Okay. So side effects of oral potassium, it causes nausea, vomiting, diarrhea, GI upsets. It's real acidic and it can burn when they take it. It can be so acidic and burn so much that it can cause no big deal, just stomach ulcers, stomach bleeding, and stomach perforation. Oh my God. So, you might want to watch their gut when you're giving them oral potassium, okay? So when they're taking this pill, because it's a giant horse pill, it's like this big, okay? Make sure they're sitting up, because what happens if that acid pill gets stuck in their throat? It'll burn a hole in their esophagus, and that's bad, right? Yeah, that's bad, okay? All right. So they need to take it sitting up with a full glass of water. If they're on the liquid, which I told y'all tastes real bad, right? Then we are going to mix it with orange juice. It can kind of, even the orange juice is acidic, it just takes some of the bitterness away from it. Do you understand? All right, you'll see you got the little stomach drawing with the red, like watch out. Okay. All right, if we're giving IV, now what's your biggest issue with giving IV potassium? What do you never do? It's going to go to the heart. So what do you never do? Never push potassium. That's how they murder prisoners, right? That's how you kill somebody. So you can never push potassium. You can drip it though. All right. It is a massive vesicant. What's a vesicant? It burns the inside of your vessels. So everybody on IV potassium is going to complain that their IV site hurts. Okay. Everybody. Because of course it's hurting. It's a vesicant. So if a patient with an IV drip of potassium says, oh, my IV site's hurting, what's the first thing you're going to do? Let's go assess it, because what if it came out and it's a vesicant, right? All right, so what are we going to do? How are we going to assess it? So you're going to palpate it. We want it to be soft, flat, right? You can also try flushing it. And if it's hard to flush and they're like, oh, it hurts, it may have burned too much. What if you get a palpable cord-like vein? That's thrombophlebitis. What do we have to do for that? Take it out, warm compress, and start it somewhere else. What if it flushes nicely, it's soft and flat, nothing's wrong with the IV, but they're still saying it really hurts? What can you do? You could slow down the infusion, or you could dilute it in some normal saline, like dilute it with some more so that way they're not getting as much, just burning the inside of the vessels. Okay. Well, we're always going to be like, oh my gosh, I'm so sorry. I know it hurts. Like this hurts really bad. And I know that, but potassium burns. But every time somebody complains, I still check it, because if we know it's a vesicant and it extravasates, it can eat their hand. Right. So check it every time, no matter how annoying they are. Okay. Never give it IV push. Maximum you can give per hour is 10 MEQs. That is a huge NCLEX thing, because that's a safety issue. Okay. Watch their EKG for dysrhythmias. If they're on a drip, they have to be on a constant EKG, which makes sense. Potassium heart, right? Do not ever add potassium to a bag. Okay. Now this used to be a nursing practice. They would send up the syringe of potassium and then you would have to squirt it in a normal saline bag. What if you got that, you threw it in your pocket and you got it mixed up with your normal saline? You just went, it's not in the Nurse Practice Act anymore. You cannot do it. Okay. All right. When you're giving potassium IV, if you give it too fast, it can cause VTAC, VFib, and then full out cardiac arrest. If they do go into full out cardiac arrest and their heart is stopped, what will you do? You're going to call a code. And what two meds are you going to give? Atropine and epi. And we'll trade those out every minute to 2 minutes. Okay. There is a rule in nursing, no P, no K. Anybody know what this means? You cannot give a patient potassium until they have good urine output. How come? How does your body naturally get rid of potassium? It excretes it through the kidneys. So if they're not peeing and you give them a bunch of IV potassium, what's going to happen?
Potassium poison?
hyperkalemia, right? It's going to cause hyperkalemia. So you have to make sure they have good urine output before you give them the potassium. Make sure you give it slowly, dilute it, check that IV site. You got them on continuous EKG monitoring, and make sure you check their potassium levels before and after. On the EKG, how do you know that their potassium is too high? You got to look at that T wave. Okay. If the T wave is peaked, then that usually means hyperkalemia. T wave usually tells us a lot about your potassium, right? If it's peaked and high, that tells me your potassium is high. If it's inverted or backwards, that means your potassium is low. Okay. Just a normal T wave. Yeah, just like a normal T. All right, there are 6 antidotes to potassium, and I want you to listen to me. Y'all will have this in every single class, and this is so NCLEX testable. Okay, and I hope y'all know your seesaws from fluid and electrolyte. Wasn't that like your favorite module? Yeah. Okay, so these are all going to go off your seesaw. So let's say we get the potassium back and it's 5.8. What's your patient at risk for? Well, they have hyperkalemia. What's their risk? Stop. What happens to your patient when they get high potassium? What's your keyword for potassium?
The heart rate.
So they can all of a sudden get dysrhythmias and they can go into cardiac arrest. Like it's a really big freaking deal. So we have to give antidotes. All right. This is going to be your quiz for next time. Okay. Because these are so important and you'll see them in so many classes. I cannot reiterate to you enough how much you will see this. Okay. So there are 6 antidotes to potassium. Number 1 is calcium gluconate. Did I not tell you he's coming for you? Okay. And that's because calcium goes on a seesaw with potassium. So if your potassium is high and I give calcium, okay. Sodium bicarb. What goes on a seesaw with sodium in the kidneys? Potassium. So if your potassium is high and I give sodium bicarb, and didn't I tell y'all potassium is very acidic? It says it in the name. Acidic. Okay. And sodium bicarb is a sodium bicarb. It's a base. So that helps you with 2 different things, right? All right, then we've got insulin. How is insulin an antidote to potassium?
You know it lowers blood glucose.
It does. How does it do that? How does it lower blood glucose?
The pancreas.
What does the insulin do? Let's start there. What's insulin's job? But how? How does it do that?
To lower the blood sugar.
Lower the what?
The blood sugar.
Blood sugar. Sugar doesn't do us any good in the blood. Where do we need it? In the cell. So what is insulin's job?
Oh, get the sugar into the cell.
How?
Exchange with. Open the door.
It opens the door to the cell. Now hold that. Insulin opens the door to the cell. Where does potassium live? Inside the cell. So if we can get insulin to open the door to the cell, all the potassium that's in the blood is going to go down into the cell. And that's how it works. Insulin and potassium have an inverse relationship. Does that make sense?
Yeah.
Okay. Then hold on to number 4. I'm going to come back to that one. Number 5 is called K-exolate. It starts with a K, like potassium's a K, right?
Yeah.
But K-exolate is the brand name. The actual name of it is sodium polystyrene sulfonate, and that's what NCLEX will ask you, and that's probably what they'll put on y'all's exams. This is the actual antidote to potassium. Now, normally, how does your body get rid of potassium?
It gets excreted through your kidneys.
Through your kidneys. But in this case, obviously, your kidneys can't catch up for whatever reason, right? So what's another way we can excrete something? If it can't go through the kidneys, well, liver will metabolize it, but how do we excrete? Pooping. So what do you think sodium polystyrene sulfonate makes you do? Dookie. How do you know it's working? Dookie. Did I not tell you did I talk to you about poop and farm? Okay. Listen to what I'm about to say. This will help you. 98% of the time, a question asks you, how do you know a drug is working? Y'all are going to pick poo-poo. It's something with poo-poo. Okay. So how do I know it's working? They're having like at least 3 bowel movements a day because I need them to shit out all of this potassium. Do you understand? Okay. So that's K-exolate. And when you guys have your quiz, I'm not going to take K-exolate. You've got to get sodium polystyrene sulfonate. Okay. Then number 6, if all else fails and we can't get rid of it, we can just dialysate them and it'll pull out the potassium on its own. Now let's go back to albuterol. Let's see if you guys can figure this one out. What is albuterol?
It's corticosteroid.
No, it's not a corticosteroid. It is for asthma. What does it do? It
Dilates.
bronchodilates. It's a bronchodilator. Now, how does it work? Has anybody ever taken albuterol? You don't know anything about it? All right. Most people, when they take albuterol, do you know the side effects? Any side effects of albuterol you might know?
No.
Most of the time when people take it, like if I'm prescribing it for a child, then I will tell the parent, hey, your kid's going to buzz around like a little bee for about 15 minutes. Tachycardia, anxiety, they get all like, because it gives them what kind of response?
A rush.
What kind of response would make you? What kind of response in your body causes increased heart rate, increased blood pressure? Sympathetic. It gives them a sympathetic response. That's how albuterol works. Now, why do I want to give a patient with asthma a sympathetic response? What happens to the bronchioles in a sympathetic response? No, you got to run. So they would dilate. That's how this is a bronchodilator because it gives you a fight or flight response. You with me? Now, in a fight or flight response, what happens to your blood sugar? Yeah. It's going to increase because you're about to have to run and it's going to give you a bunch of glucose. Now, as you increase glucose, how does your pancreas respond? You got a whole bunch of new sugar. What does your pancreas do? Increase what?
Produce insulin.
Makes a ton of
Insulin.
Oh. Insulin
Opens the door.
and allows the
Potassium to come in.
That's how this works as an antidote. So let's follow that back through because that's a lot of patho. Okay. All right. What does albuterol do? The inhaler. What does it do?
It bronchodilates.
Bronchodilates by giving your body a.
Bunch of sugar. Well, not sugar.
It gives you a what type of response?
Sympathetic.
Sympathetic or fight or flight response, right? Okay. So albuterol is going to give you a fight or flight response. What does that do to your sugar in a fight or flight response? The sugar's going to go up. The pancreas is going to respond by producing a bunch of insulin. Insulin opens the door to the cell and the potassium can go in. We got it? Okay. Your 6 antidotes are on your quiz for next week. Got it?